Hello, everyone. Welcome to Medicare Made Easy. This is a regular broadcast. Blue Cross and the Blue Shield Association here in Louisiana, and we're very pleased to be with you here today. I just want to make sure that we are going to talk to you as the day goes on about the basics of Medicare. We're going to go back to the beginning, the A's, B's, C's, even the D's of Medicare. My name is Mike Bertaut. I'm a healthcare economist here at Blue Cross and Blue Shield of Louisiana. And it's my job to make sure that we understand the way that people purchase their health insurance, the way they pay for it, and more importantly, the way they use it to make sure it's meeting all of their needs. I'm very pleased today to be joined by Tress Fereday. I'm just so excited to have you here today. Tress, why don't you tell us a little bit about your position here?
All right, thanks so much for having me. So I'm Tress Fereday. I work on the Medicare sales team. And what we find, a lot of people have a lot of questions when they're getting ready to make their Medicare decisions. They're kind of not certain what to do, what are next steps. And so we're here today to kind of help give some guidance and answer some questions that we kind of hopefully can make Medicare a little easier when you're making those decisions.
Well, that would be awesome. And thank you so much for making the time to come stay with us today. And for all of you who are joining us, I want to make sure you understand that if you have any questions that pop up during this program, it'll run about 30 minutes. Please drop them into the chat box and we'll address as many of them as we can while we're live. If we don't get to your question during the live part of the broadcast, we'll be sure to answer it afterwards. So you can keep watching that chat box and make sure that you get your answers. Now, Tress, some very important things coming up, although it always seems like the annual enrollment period is a little ways away. Boy, summer has blown by really quickly. And so I think it would be interesting to talk about that right now, open enrollment.
Right, so open enrollment for Medicare starts on October 15th, and it does seem far away, but we'll blink our eyes and that time will be there. So on October 1st, you can start kind of sharing information and kind of learning about the new plans. And then October 15th through December 7th, they call it the annual enrollment period. You may hear them say AEP. So that's the time you can choose a plan or make some coverage changes. And then those plans, any plan that you would enroll during that time would become active on January 1st at the beginning of the year. So that time is coming up. That would be an opportunity to ask some questions, look at some plans, make sure you're getting the coverage you need. And we're going to talk a little bit more. We have some licensed agents who are available to answer those questions for you, so you don't have to go it alone. You can get the assistance you need when open enrollment shows up.
That is excellent news. And I think you and I would both encourage people to get involved as early as possible to make sure they have plenty of time to make decisions. When it comes to Medicare, you have a lot of options, and we want to make sure that people get the best opportunity to enroll in a plan that fits their needs the best. So to kind of help you get a feel for what will be available and the kind of choices you're going to make, we've put together a video voiced by me that we're going to run and let you have an opportunity to see some of that information right now. Medicare is the federal health insurance program that helps pay for some medical services for people 65 and older and younger people with specific disabilities. Medicare has parts. Each part has benefits that can be combined to create a health coverage plan that best suits your needs. Part A is hospital insurance. Services include inpatient hospital, skilled nursing facilities, home health, and hospice care. Part B is medical insurance. Services include doctor visits, outpatient care, durable medical equipment, clinical lab services, and preventive services. Parts A and B together are what is known as Original Medicare. Under Original Medicare, beneficiaries could receive their health care benefits from any Medicare provider and have the provider paid directly by the federal government. Part C is Medicare Advantage, an alternative to Original Medicare. Private insurance companies offer Medicare Advantage, which comes with all the benefits of original Medicare, plus extra benefits such as vision, dental, hearing, and usually Part D prescription drug coverage. To enroll in Medicare Advantage, you must live in the plan's service area, have Medicare Parts A and B, and continue to pay your Part B premium. Part D is prescription drug coverage. Part D covers outpatient prescription drugs. Plans are available from private insurers. Finally, there are Medicare Supplement plans, also known as Medigap plans. Original Medicare only covers 80% of your expenses, so Medicare Supplement helps fill in the gaps. Medicare Supplement is private insurance coverage that helps cover some of the costs you will have with original Medicare. A Medicare Supplement plan does not include prescription drug coverage. You can get help with copays, coinsurance, and deductibles, and have the freedom to choose almost any doctor, but it does not include Part D coverage. You cannot have both a Medicare Advantage plan and a Medicare Supplement plan. It's wise to look at the big picture when deciding which choice fits your needs. The Medicare initial enrollment period lasts for 7 months, 3 months before your 65th birthday, your birthday month, and then 3 months after your 65th birthday. This is when you can sign up for Parts A and B and enroll in a prescription drug plan if you want that coverage. You can also choose a Medicare Advantage plan that provides the benefits of original Medicare plus extra benefits and usually prescription drug coverage. If you want Part D, prescription drug coverage, you should join during this period to avoid penalties. The government may charge a late penalty if you enroll after your Medicare initial enrollment period expires. If you have a disability and are under 65, you will automatically get original Medicare. The Medicare Supplement open enrollment period lasts 6 months, starting on the first day of your birthday month or your Part B effective date. You can purchase a Medicare Supplement plan during this period, regardless of your health. After this period expires, you may pay more for a plan if you have past or current health problems. Every year, starting on October 1st, insurance companies share information about their Medicare Advantage plans for the upcoming plan year. During the Medicare annual enrollment period that starts on October 15th, all eligible beneficiaries can enroll or make changes to their Medicare coverage. These plan changes become effective on January 1st. It's vital to prepare before deciding which plan is the best fit for you. Assess your needs. Understand your own health needs, which may differ from your peers. Ask questions. Be sure to ask these important questions. Are your doctors a part of the plan you're considering? How much will your prescription drugs cost? What other yearly healthcare benefits are offered? Get support. A qualified agent can guide you in finding coverage that meets your health needs and finances. All right. Well, that was a nice video. I did a good job, if I have to say so myself.
You did an excellent job. Thank you for that.
You're welcome. But you know, one thing is really clear now that I've gone back and watched the video a couple times, it's complicated. There's so much information that needs to get communicated to folks. I noticed we already had a question in the chat box, which was someone asking, once I enroll, do I have to re-enroll every year?
No, you do not. If you're happy with your plan and it's fitting your healthcare needs, to stick with it, stay with it. You'll get new information like an annual notice of change, things that alert you if anything's changing on your plan. But if it fits your health needs and you're getting what you need, then leave it as is and be happy with your plan and kind of leverage the benefits to the best extent. So yeah, you're fine if you want to stick with your plan.
I have noticed that whether you're on traditional Medicare or a Medicare Advantage plan, the government or the private insurance companies tend to tweak the plans a little bit every year. Like for the government plan, the premiums go up or the deductibles get adjusted for inflation. And I know that some of that's driven by regulatory changes and some of it's CMS's decision, but it doesn't mean you have to change plans. You'll get information, right, to let you know what the changes are.
Right, you'll definitely get information on the changes. You can review it. And also, if you have an agent, if an agent helped enroll you in your plan, you can call them. They can talk you through it and kind of make sure, because you just want to make sure your plan still fits your needs. You know, when you first enroll versus maybe a few years later, maybe what your needs might change a little bit. Like, can you get care close to home, or do you need more of a broader doctor's network? So things like that, that may change for you. And so once again, if you have an agent, you can call them and y'all can talk it through and go, you know what, this plan does still fit my needs. Let's not make a change.
You know, the key that I'm drawing from our conversation is, for goodness sakes, don't go it alone.
Right.
There's really no reason in this day and age where you can't reach out to an agent, make that phone call, and get somebody who does this for a living, who's very smart, like Tress, to kind of guide you through these changes as they come along and make sure the plan you end up with fits your needs better than anything. And, you know, I just want to reiterate, you've got time around your birthday. When you turn 65, I'm just a few years away. You know, my birthday is in July. So I know that come April, I'm going to be thinking already about what plan I want. I might not select it by the time my July birthday rolls around, but then by the time October is there, I've got to make a decision and lock that in so that my coverage will be secure. And from 65 years old on, I mean, it's a really big deal. So don't get overwhelmed. Don't look through this material and think, oh my goodness, I'll never understand it. It's easy. Ask for help. You know, there are licensed, certified agents out there who train constantly to make sure they know everything there is to know about how these different Medicare plans work. And these agents are available 7 days a week. They're right here in Louisiana. You're not going to be calling some phone line in another country or another state. It's going to be Louisiana specific. When you reach out to our agents, there's no obligation to buy anything. You can just take that information in and make your own decision. It's just a great free resource, and it doesn't make any sense, I think, to pass up the opportunity to get help from a pro.
Right, definitely. So our video, you know, it referenced the Medicare initial enrollment period. So if you're turning 65, you'll have that 7-month window, 3 months before your birthday month, 3 months after, you'll have that window. We've been talking about the annual enrollment period as well. So you're going to have options to talk to an agent and just kind of get your questions answered and get organized and be prepared for whatever timing makes the most sense to you. So yeah, there's no obligation, there's no hurt in having a conversation to determine, help guide you on what direction you want to take. And definitely, you mentioned they're licensed through the state of Louisiana, and they take an annual Medicare certification. So they are, you know, trained and qualified in Medicare, and that's their focus, and that's what they do. So they will be able to answer your questions and kind of help guide you where you need to go.
Excellent. Are you going to introduce us to some agents today?
I think we are. We're gonna get to see some of our agents. These are cool. Here's the number you can call if you want to connect with one of our agents and have some of your questions answered. And okay, so these, this is some of our team. We have a lot of licensed agents. These are some of them. These are our Blue Cross employee agents who are focused and dedicated to Medicare. So this is Ann Booth, Kali Crumpton, Hope Falgu, Kathy Klinger, William Phelps, and Ricardo Vega. And so Mike mentioned these agents live in Louisiana. They're your family, your friends, your neighbors. You may know some of them. So they know, you know, what's going on with Louisiana and what we care about. They know you live in a parish, not a county. They probably can't even pronounce the parish. If you catch them on a good day, they might share their good gumbo recipes. So, I mean, they are Louisianians just like all of us. So they're really gonna be able to help guide you and get you the coverage you need.
That's just so awesome. I've been blessed to work with most of the people that you put on the screen for a few years now. And I have not had the slightest hesitation sending my friends, my family, people who are dear to me, directly to them to make sure that they're getting the right information and making the choices that best fit their needs as they age, and as we get a little older, we need a little more healthcare, we need a little more guidance. But turning 65 doesn't mean you have to give up your doctor, or give up the healthcare professionals you've trusted for all these years. And Tress and the people you saw on the screen, they'll do a really good job of making sure that you're directly connected through your insurance to the people that you trust to take care of you. And that's really important to us. It's just an incredible option to be able to use this qualified agent network to kind of, clear up the muddiness of what Medicare Advantage, what open enrollment looks like. Do we have anything else in the chat? I was looking for a minute just to see if anything else had popped up.
We do have Spanish speaking agents as well. So if Spanish language would help you and kind of having your conversation about Medicare, we have those as well. So if you call the toll-free number that you see on your screen, you could connect to a Spanish language agent. And then kind of following on what you were talking about, Mike, that we call it the 3 Ps, and it helps you determine, is this the plan for you? So provider, are your doctors and hospitals in network? Pharmacy, are your prescription drugs covered? And then plan value, like does the plan offer you some extra benefits and things to help keep you well? So we kind of use that as a structure to determine, which plan is the right fit for you. Because if you hit all your 3 Ps, then you're probably on the right plan and you're going to get the level of coverage you really want and the healthcare benefits that are going to really keep you well.
And you raise an important point. I've told my family when they're turning 65 and they begin to shop, make a list of the healthcare providers that are important to you. Make a list of the prescription drugs you're going to need on a day-to-day basis. And when you have that information in hand and you provide that to an agent, it really speeds up the process of making sure that you're in the right network, that you're connected with a plan that will satisfy your needs the best and keep you connected to the people you trust to take care of your health. It's a very big deal. And I want to make sure that people can take advantage of that. Now, we do these Medicare Made Easy live streams every month, just about, and we want to make sure that these are available to you all the time. We have a YouTube channel at Blue Cross, at BCBS LA, I believe, is the YouTube channel that you can use to look at all of the archived video that we have at your convenience. You don't have to show up when we show up. Also, we have the blog that I write most of the content for, straighttalkla.com. Straight Talk also includes a video library that you can also access through our YouTube library, because healthcare is complicated, and we know it is, and we work so hard to make sure that we can express the answers to folks in plain English, without burying them in insurance-ese or medical language, or we just want it to be simple and to make sense. And that's a battle in itself that's worth fighting, and something that we do, I feel like every day. You'll see if you want to watch the Medicare 101 video we ran earlier, that's on the YouTube channel and it's archived there so that you can go back and watch it or refer it to a friend. I know a lot of people who are in their 40s and 50s are now helping their parents buy insurance. Is that something that you run across very often?
We do, and that's great. If a family member or a friend wants to help you, or your parents or whomever, if they need some assistance, it's great, because sometimes, it's a lot of information and it might seem overwhelming. And so just kind of work with an agent, sit down, so they can, someone who's enrolling our plan can note an authorized personal representative. So someone who's going to help them with their healthcare decisions and their insurance. So that would definitely be appropriate. They could be on the phone as well with the agent to kind of listen and ask questions. Here's the deal: you want to be in the right plan, you want the right fit, you need to get the healthcare coverage you need. And so having someone else to kind of help assist you through it is a great idea.
And so when you are, if you're in a plan and you're not that happy with it, if it's really not suiting your needs, Can you remind everyone when the opportunity to switch plans, no harm, no foul, would
Right.
be?
So that we talked about the annual enrollment period. So that's a great time to kind of look around at plans. If it's not fitting, your needs aren't fitting you, the plan's not fitting you, you can look around, you can talk to your agent, you can kind of see what's going on to determine. So that October 15th to December 7th is a great plan, because then you're going to learn about the new plans for 2023. If your plan is fitting your needs, you know, stick with it. If it's not, that would be a great time to kind of ask some questions and learn a little bit more. But yeah, back to, you know, the providers, the pharmacy, the drugs, and other extra benefits. Like, you need to make sure you're kind of hitting all those boxes and kind of getting what you need.
Very good. We're going to drop into the chat box information on the other Facebook Live events.
Yeah.
So we have a question.
Oh, okay. I'm sorry. We do have a question that came in. I missed it. Go ahead.
What if you're turning 65 but still working? Do you have to get Medicare?
Oh, an excellent question.
So if you, there are people who delay, you know, delay signing on for Medicare. If you have employer coverage, they call it credible coverage, and you're going to continue to work, you know, you have that opportunity. So what you'd want to do, you know, if you're on your commercial kind of under 65 coverage, one, go to your employer and go, is there retiree coverage? Some workplaces have that, some do not. So kind of knowing where you're headed is a great kind of moment to have that conversation. If you're delaying it and you're on your employer's coverage, you'll be able to kind of delay, you know, getting onto Medicare. But then once you are kind of moving, you want to make sure, you know, you had that credible coverage, and you can show them that's why you delayed, that you don't want to get any late enrollment penalties or anything.
So it sounds like it's very important as you're approaching 65
Right.
to be in touch with the human resources department at your
Right.
company or whoever manages your benefits
Right.
to make sure you can get an understanding of what their transition looks like,
Right. Right.
whether they offer a retiree plan or whether you'll be on your own at that point.
Yeah, that would be great information to have kind of in advance. So you know kind of where you currently are and where you're headed, that once that time comes that you are planning to retire. So yeah, I would definitely start with your HR department and get the guidance from them so you know where you're in a good spot.
Let's see.
We have another one.
Yes,
I have
go ahead.
parts A and B and private insurance. Do I need Medicare C and D?
If I have parts A and B and private insurance, do I need C and D?
Medicare, yes.
Yeah, the alphabet soup is caught up with this poor person. And I don't blame them.
Where's XYZ? We missed that one. What is private insurance?
Yeah, I was
What does that
wondering the
mean?
same thing. If I have A and B and I have a supplement,
Yes.
then
right,
I
you're
just
fine.
need Part D for drugs.
Right.
And I'm good to
yeah,
go.
Right.
So I
correct,
might actually have A, B, and D and a supplement.
Right.
And then I've got I've got complete thorough coverage.
Right. Correct.
But if I only have A and B and I don't have D, then I don't have drug coverage.
Right.
So you would only use C, if I remember correctly,
Right.
as a replacement for A and B, right?
So
And possibly D as well.
well, Part C is Medicare Advantage.
Right.
And so you would have, most people get their Part A for no cost because they've worked their 10 years. Part B, you would have, you know, you would have some costs for Part B. Part C is Medicare Advantage, so it kind of wraps it up. So you would get drugs, you would get those other things in your Part C. So assuming that question meant a supplement,
Yeah,
I'm with you.
on the private
Right,
insurance
right.
part.
And assuming that's a Medicare supplement, they would want to add a D.
Yeah, what people don't, a lot of people don't realize is that Medicare on its own has you still have a little work to do, you know, because you work 10 years of your life, 40 quarters, and
Yeah.
you're paying your Medicare taxes. And that gets you access to the Part A hospital pool, right? For free. You have no premium.
Right, right.
But it still has a deductible and it can still have copays if you stay in the hospital a certain number of days. So it's not exactly free. The premiums are zero,
Right.
but you still have to spend money to use it.
Right.
If you have Part B, you pay a premium for that. Right now, I think it's around $200 a month for the average person. But you have a deductible and copays and co-insurance for that. And so when you get Medicare Advantage, you've kind of wrapped all of that up into one bundle, and you only have to worry about the Medicare Advantage copays and deductibles, and everything else is covered.
Right.
So it does simplify things. And sometimes you can buy Medicare Advantage plans that have Part D wrapped up in it as well.
Right.
So you get C and you've got everything, right? Again, with the alphabet, right? So go for C and you've got everything else covered. How about that for an easy descriptor? I think we have one more question. Go ahead.
I hear people talking about a penalty for not enrolling on time. Please explain.
Penalties for not enrolling on time.
Right. So timing matters. And so that's why I think, depending on if you're turning 65 during the year or open enroll, when you're becoming Medicare eligible, that's why I would recommend calling and talking to an agent. They can really help you on those dates and those times, so you can avoid any kind of penalty of any sort. So that's where they really can help you, because it really varies by person of when you're becoming Medicare eligible.
Gotcha.
So yeah, you definitely want to avoid any kind of penalties.
It sounds like what we're really talking about is missing that 3-month window after your birthday, right?
Right.
Yeah.
Right.
So if your birthday happens and 6 months down the road you haven't enrolled, you could be in a penalty situation.
Right. So you just have to be careful of the dates and kind of make sure you're on top of them. And if you need some guidance on the dates, and they can help you do that.
Yeah, if we haven't convinced you yet that this is complicated enough and you need a pro to get you through the process, then I don't know what else I can say, really, to get that ball rolling. We're just about to wrap up here. So I just want to say it's been a delight to hang out with you today, Tress. And thanks for coming on TV with us. We enjoy very much educating our population here. Remember, Blue Cross Blue Shield of Louisiana, we are the primary source of healthcare payer for over 1 million people here in Louisiana. So we want to make sure that everybody is taken care of, that they have the information they need to make good decisions. And we're very serious about it. Louisiana is our home turf, and we want everybody to know that we're watching out for you. If you're a Louisianian, we'll take good care of you here. All of this information is still available out on our YouTube channel at BCBSLA. And don't forget to check out the Straight Talk blog, straighttalkla.com, where we also have a lot of information as we move through these periods. Any final thoughts?
No, it was fun to be here. I appreciated it. And hopefully we help answer some questions and gave you some guidance on who to call to really get your specific questions answered, because we're just trying to simplify it as much as we can. Excellent.
Excellent. Thanks again. We'll put a graphic up for you so you can see upcoming YouTube Live, or rather Facebook Live events right here at this channel. And we'd love to see you again and come back and visit with us and bring your questions, because we love tackling them live online. I'm Mike Bertaut, healthcare economist at Blue Cross and Blue Shield of Louisiana. Thanks for your time, and we hope to see you again back here soon.